People, including refugees and vulnerable households, face losing life-saving assistance in the coming weeks. WFP has already reduced rations and halted support in some camps, with school meals and nutrition programs hanging in the balance. Now, without urgent funding, progress in education, health, and community stability is at serious risk. Well, today we're joined by Gianluca Ferrera, who's the WFP representative and country director in Cameroon, to help us understand the breadth of the crisis and what needs to be done. Gianluca, thank you very much for joining us, and welcome to the program.
Good morning, and thanks for inviting me.
So 500,000 people risk losing food aid. Can you take us through the situation in the refugee camps, the displaced areas? What are you seeing on the ground, and what are people experiencing at the moment?
Yes, thank you very much, as I said, for the invite and for allowing me to highlight the situation in Cameroon. Cameroon is one of the most neglected crises in the world nowadays. A recent report by Norwegian Refugee Council highlighted the fact that Cameroon is the most neglected crisis at the moment in the world because of lack of funding, but also because of lack of media attention. So that is why it's so important for me this morning to be talking to you about the situation in Cameroon. 500,000 people, including refugees from Nigeria and Central African Republic, and internally displaced people in Cameroon, are on the verge of losing their food and nutrition assistance in the coming weeks due to severe funding shortfall that WFP is currently facing. Those are the people that WFP has been assisting since January this year. We have already started implementing ration cuts, reducing by up to 50% the amount of food provided to the families. The number of people receiving assistance has already been reduced. For instance, in Minawo camp in the far north of Cameroon, near the border with Nigeria and Chad, WFP has been forced to stop assisting about 26,000 Nigerian refugees. The camp hosts almost 55,000 refugees, and 26,000 out of this population cannot receive assistance anymore due to the funding cuts. In Gado camp in the east, where WFP has been assisting Central African refugees living in Cameroon, also WFP was forced to reduce rations, and if no additional funding is secure, as we were saying earlier, WFP will significantly scale back operations, and this is at risk of worsening severely hunger among thousands of families.
So how are families in these refugee camps surviving on half the rations? What I mean, it just sounds so dire now. How are they coping?
They are adopting all what we call the worst coping strategies. Of course, they are reverting to not sending kids to school, reverting not to spend any more money on health and other expenditures, so prioritizing the little resources they have for food, renouncing to other very important needs. People may start to be on the move and start to migrate, looking for places where they can hopefully receive better assistance or find way to improve their livelihoods. Those camps, those displaced population are living in very unsecure environments. So the risk of armed groups and other factions offering a livelihood opportunity to those population is also a risk that we see. We have been seeing increased number of security incidents in the far north of Cameroon over the last month. So the risk that the lack of assistance offer opportunities for households and for those groups to offer livelihood opportunity to those people is really big.
I think you've given us one clue in terms of the consequences of this, and that's education being affected for children. Talk to us about health, because not getting enough nutrition must have consequences.
Absolutely. Unfortunately, those regions experiencing severe food insecurity are also experiencing bad malnutrition rates. And so food insecurity and malnutrition goes hand in hand. And with the reduction of aid, reduction of efforts by the international actors to provide support, the risk of seeing increased malnutrition rates is huge. WFP and the Ministry of Health have a network of partners who monitor the situation through the health centers. So we do try to have an understanding on how the situation evolves. But indeed, not having enough supplies to respond to the needs may pose those children at risk in the weeks and months to come.
What's your call to the international community? Because this really is about a funding shortfall, isn't it?
It is. We are indeed, as I was saying earlier, Cameroon is one of the most neglected crises in the world at the moment. We are facing a world of multi crises, so not all of them get the attention and the resources from the international community they should. So we are really calling on all the donor countries, the member states of the United Nations, to step up and support. We are also appealing to the government of Cameroon to, in the short term, to provide also resources and capacity to cope with the situation. We have very good relationship with the government. The government is aware of the reduction in the support that the international community used to provide, and is trying to adjust its budget and to provide to provide resources to support. So in this transition, where we see governments, host government coming and taking more and more responsibilities, while we see international community withdrawing, we need to keep the public opinion informed and keep them aware of the risk that vulnerable population face in these transition times.
If funding doesn't come through in the next few months, what could we see happening more and more?
Well, we could see a reverse of the development and resilience building gains we have been building over the years. Those are regions exposed, as I was saying earlier, to multiple shocks, security being the most important one, but also natural disasters, chronic poverty. So those populations do require special attention. Those regions do require special attention. And if we reduce assistance, if we reduce critical funding for key aspects of the human life, health, education, life-saving assistance, then we see risk of, as I was saying, people saying food insecurity going up, malnutrition going up, migration happening, insecurity further increasing, people resorting to the worst coping strategies. So we are really going backward instead of going forward. And this is definitely not what we want to see in those fragile regions of Cameroon.
You have operations all over the world. Are you seeing a general situation where funding is getting less and less to help people like those in Cameroon, or is it some regions more than others? What are you seeing?
Yes, we see, unfortunately, a global reduction of international assistance to WFP and to other humanitarian partners. So it is not just WFP but it's the broad range of humanitarian actors, UN agencies, international and national NGOs. So the humanitarian actors are affected by the reduction of humanitarian aid. Certain crises more than others. As I said, it is not an equal reduction. Some countries see this reduction more pronounced, but we really see a new deal in the world where indeed there is maybe a different repartition of charges between donor states, a more role, more importance, more resources allocated by those countries. But we really need to rethink the way we provide international assistance, because shocks will continue to happen, unfortunately. We have 57 conflicts, active conflicts in the world nowadays. We have natural disasters. So capacities to respond and to provide assistance is essential, and we need to rethink it nowadays.
Gianluca, thank you so much indeed for making this situation more aware for our listeners and viewers, so that perhaps some action can be taken to assist with funding. But thank you so much indeed. It's such an important story.
Thank you very much. Thank you for inviting me.
All right, that's Gianluca